So hello everyone. As you would know, the results of NEET SS 2025 were declared a couple of days back, and it is of immense pleasure to all of us in the Marrow family to talk with Dr. Selwin. He has done remarkably well in the NEET SS Critical Care Medicine group, and he has actually secured rank 3 in the recently concluded NEET SS. So welcome, Dr. Selwin, and a big congratulations from everywhere here in the Marrow family to you for your splendid rank.
Thank you.
So just let us get started. Tell me how you're feeling right now, and what are your plans for the future?
Thank you, sir. I'm feeling really happy for the rank that I got in this recently concluded NEET exam. I'm an anesthesiologist. I have been working with a full-time intensivist since I completed my post-graduation. So I'm looking forward to do DM in critical care medicine, sir. Since I got a very good rank in this exam, sir.
Right. So in terms of first you said your background is anesthesia, right? And as you would know, in this year they had a change in the exam pattern, because now critical care previously was part of the medicine group, and now they have kind of shifted it to the critical care medicine as a separate subgroup. So obviously there was a lot of speculation regarding what would be the exam pattern, what would be the questions, right? And whether it would be slightly beneficial for the anesthesia residents now that they have kind of removed it from the medicine group. So what was your experience? What did you find in terms of the exam? How was the exam pattern this year around? And whether it was useful for you or whether it became more difficult. So if you would shed some light on
that. Yes, sir. So I completed my post-graduation in 2021 May month. But I was renewed by October 2021 because of the COVID second wave. So later, my dream was to get my super specialization in critical care medicine. But that year, there was NEET SS. It was the critical care medicine, a separate question paper, and a group was there. But later, actually, I got a rank, but what happened was I then wanted to try once more because it's not good that time. So later, the question paper got changed, and critical care medicine group was suspended, and it was included in the medicine group. So I joined in Christian Medical College, Vellore. So that time I joined as a senior resident. Then, since I wanted to do specialization in this area, I joined in the postdoctoral fellowship plan, the program. It is for 2 years. So I was continuing as a fellow resident in CMC Vellore, sir. So the recently, in the month of November 2024, I think the announcement came that they are going to bring back the critical care medicine group. So I applied for this examination, sir.
So how was the exam questions, or how was the exam pattern in terms of the questions? Were all questions coming from critical care this time around? So or were there questions from anesthesia or from cold medicine as well?
So out of the 150 questions, we felt that 150 questions were completely from the critical care medicine. So the subject-wise, they have given more importance for the toxicology part, as well as rest of the critical care medicine subjects were equally distributed, like the ventilation, ABG analysis, and the general intensive care medicine part. So the questions were equally distributed, but what I found was more importance was given for the toxicology part. So I felt that the question paper stick to that announcement. So there are 150 questions are completely from the critical care medicine background only.
So that is great to know, because I feel once they have made an announcement, they should basically stick to it. And it is good to know that actually did that. And obviously, somebody who's working in critical care like you will always have some extra advantage because the practical aspect that you're seeing patients in the ICU, you're applying your practical knowledge always helps in such an exam as well. So I was wondering, like, what was your preparation strategy and how did Marrow as a resource, how did Marrow help you in your preparation in terms of the videos or the MCQs?
So I subscribe to the Marrow Medicine Group SS plan. So I subscribed in December 2023. Sir. So I wanted to get into this critical care medicine DM program. So since that time the question paper was under the umbrella of this medical group, so I subscribed to that. Then my initial part of the preparation were completely like this medicine subject, like all the specialties. I was watching these videos one by one. And I was, I was very happy that I got introduced to Dr. Rajan videos, and especially because I was more inclined towards his videos. I was watching one by one, and I completed almost GIT and liver, as well as some 60 to 70% of the rheumatoid videos, and some 50 to 60% of the nephrology videos, which were more relevant in my daily practice also, sir. Because since I was working in a medical ICU where I was seeing a lot of medical patients, and it sounded more relevant to me for my medical, for my intensive care practice. Um, I was I was preparing well. Whenever I got time, I used to see videos as well as the critical care medicine part also. Since I was more, I was working in that area. Those videos were, I was able to complete that without any problem. Seamlessly, I was able to complete. So I watched almost like 25 to 30 videos of the critical care medicine. I finished well, sir. I was preparing initially like this, sir.
Okay. And so when the announcement came that now the exam pattern is going to be more from critical care, so did you change your strategy? Because obviously previous exam pattern was more for medicine, and now obviously the exam pattern kind of changed into critical care. So did you not kind of shift your emphasis more into critical care, or was your baseline critical care knowledge helping you in that regard as well?
Actually, once the announcement came, I haven't switched my preparation strategy. I mean, the duration of working hours was also become so hectic for me. So I was unable to completely concentrate on my preparation well. But reading and attending my classes helped me a lot, definitely. I used on and off narrow notes, especially the critical care medicine part. But the experience that I have gained from working in critical care medicine, almost October 2021, since 2021, like that, I'm working in this ICU, full-time ICU. So for these 3.5 years, experience in this brand helped me a lot. But the reinforcement of the knowledge by this online platform, Marrow, really helped me a lot. Yes, sir.
Obviously, one thing that you have mentioned, and I think that is also very important, is to work in a good ICU. And CMC Vellore, as you know, is one of the best ICUs in the country. So if you're working in a good ICU, that knowledge always helps in your exams as well. So in terms of the MCQs, like you mentioned, like did you depend on the Marrow resources for MCQs, or did you how did you prepare for the MCQs? Did you do any other books in terms of the MCQs, or were you just happy to brush up your theory and just apply for the grant tests? How did you do your MCQ part of the preparation?
The MCQs part, truly, I did not work on MCQs. But I wanted this, I know I'm weaker in this biostatistics part. So some biostatistics MCQs I worked with Marrow, like the MCQ part of the biostatistics I worked, but critical care medicine I did not really concentrate much on the MCQ, but the core knowledge that I have gained from the videos, experience, that really helped me a lot.
Yeah, I can understand that. So, in any case, like obviously, once you subscribe to that medicine, I think module, it kind of gives you access to a lot of other resources as well, like biostatistics, as you mentioned, X-rays, and also I think depending on what your weak areas, you can always build upon those areas. Obviously, you had a very good critical care background also to start with because of your working knowledge, as we say. So, if I can ask you, so you say that you want to pursue DM critical care, right? So that is your goal. So, is there any particular institute that you have narrowed down on in terms of that you want to pursue for the teaching and training?
Yes, sir. Since 2021, I am in this CMC Vellore. So last 20 months, I have been an academic registrar. And before that, I was working as a non-academic registrar. So I want to continue in this institute. Since there are 5 seats in this institute, in SS course, rank 3, I'm going to take DM in critical care medicine in Christian Medical College.
Wonderful, wonderful. So I think at the end of the day, you're getting an institute of your choice. You're getting the institute where you have been working for so long. So it's like a home ground for you, if I can say. So I think that is the perfect recipe or perfect thing that anybody can actually ask for, to work in a familiar environment and to get further training in critical care, which itself can be quite challenging, as you know already. So, finally, if I were to ask you, like in terms of, since you have already kind of been a Marrow subscriber for quite a while now, not just for the last 6 months, but probably for more than that. So in what ways can we actually improve our course? Because at the end of the day, we are also kind of catering to a lot of critical care aspirants, and some might not be as well trained as you in terms of critical care exposure. So what are the things that we can actually add to the existing resources to improve from a viewer's perspective or from a subscriber's perspective? Things that we can improve going forward.
Since I have recently encountered this NEET SS question paper, so the 150 questions, almost some 30 questions were from the toxicology. And so that level of questions, to solve that, I think, definitely the knowledge in the toxicology should be so high to solve those kind of questions. So the ventilation part, ABG part, and understanding the shock and characterization of the shock, as well as characterization of the acute kidney injury, treatment of that, as well as these type of questions are very easy to solve because these are all my day-to-day practice. Since I have been seeing a good volume of poison patients as well as snake bite, insect bite, but the questions that I encountered from the toxicology were quite tough ones because I was able to understand that 26 questions that I failed, sir. So almost 80% of them were from toxicology. So I think we can stress more on this topic in the future, sir.
Yeah, I'll keep that suggestion of yours in mind. We already have a few toxicology lectures, as you would have noticed already. So we have added toxicology lectures recently, almost like a couple of months back. But again, in a critical care, like any national level entrance exam, again, it is very difficult to predict because this time it might have been toxicology, next time it might be something else. So at the end of it, I feel like as an aspirant, you have to be kind of covering all the bases because you do not know really what the the person who's, sometimes these exam MCQs, they kind of get shuffled, they kind of get selected from a question bank. So there's some amount of luck factor as well in terms of from what module you end up having more questions. But maybe because you are so well trained and you already had a good background knowledge in terms of the other aspects, so those aspects also helped you in terms of making them feel slightly easier than maybe compared to other candidates who might not have that level of working knowledge. But again, it's like great to hear from you, Dr. Selwin. Absolutely fantastic to know that you have done so well, and even better that you're going to pursue the DM in the institute that you're already working in. So kind of getting to pursue with your familiar people around, with your teachers. And from our side in Marrow, we wish you all the best. And I personally would love to meet you someday, maybe in some uh, conferences or in some, because anyways, critical care is a very close, small
Thank
sector.
you. Thank you so much, sir.
And congratulations. And if we have been able to add some value to your preparation, we are very, very grateful that you have given us the opportunity. So thank you, Dr. And congratulations once again. It was great to know you.
Thank you, sir. Thank you so much. So even I have a very good experience with Marrow. I mean, since I had been told that critical care medicine group was the exam that I am going to encounter, then I would have subscribed to a critical care medicine group rather than a medicine group. But fortunately, I was able to see this medicine group modules and the various videos, especially since in my post graduation days, I have no marrow. So I would not have got a chance to listen to the lectures of, I mean, the way of describing everything, by, especially for Dr. Marcus. So I have become a very great fan of him. So I mean, because of him only, I was able to navigate so many modules, so many videos. I mean, I think if I get time, I will definitely subscribe one more time to Narrow Medicine SS Group. And I will watch all those videos once again and get a note so that I will revise in my future. Sir. Definitely, sir.
Yes, that is something actually a lot of residents do. Even in my institute, a lot of people continue to subscribe to Marrow even after they have got or they are doing their residency, just because they kind of get a lot of reinforcement in terms of knowledge from various modules of various specialties. So it's completely your choice. We are happy to help you. So all the best, Dr. Selwin, with your future, and wish you all the best from everybody here.
Thank you so much, sir. Thank you.